Welcome, everybody. I'm so excited. We have Dr. Ore with us today to talk about her journey and the kind of work that she's doing in River State. Dr. Ore, thank you very much for joining us today.
Thank you so much, Dr. Banda. It's a pleasure joining you, and it's an honor that I was invited to Global Health Uncensored. Thank you so much.
Awesome, awesome. Before we begin, I know like I got to know you through the work that you're doing on LinkedIn and Twitter. Could you share some light in maybe your early life, your journey so far from y- stages in Nigeria to where you've gotten to now?
I grew up in Port Harcourt. Port Harcourt is where I'm based now for my work. But growing up as a child, I was the first of four children in a family with two working parents. My dad being a medical doctor with his private practice at the time, and my mom was a magistrate in my early childhood years um, in the legal system. And so I grew up watching both parents work. And so I think from them, I saw the whole professional values, work ethic. I saw it really up close. And it was a close knit family. Both parents were, while very strongly professional, they were very keen on building and nurturing our family life. So, very close to myself and my siblings, very interested, very involved in our childhood, in our education, being actively involved in the parent body at our schools, attending school events. So I grew up in a very loving and nurturing home environment. And so I believe that that is a very solid part of what made me who I am today. My siblings, we had an interesting childhood where, aside from going to school or going to church, we almost walked everywhere. And of course, being the first, I was very self-important and very I had this great sense of responsibility over them. And obviously, they didn't find it very funny a lot of times. And so they tease me about it today. So I would say that that loving and nurturing home environment is a significant part of what has built my personality, and segued into myself as a professional today.
I mean, I growing up in a big family, I can attest to, how the dynamics play. If you're either the youngest in the family. But can you also shed some light on your professional journey so far, your education? How did you decide to eventually venture into medical school and now to public health? Can you walk us through that?
So, sharing that both my parents were a doctor and a judicial officer, I was a bit torn and confused. Sometimes after school, we would go to my dad's clinic and generally watch him interact with patients' relatives, management of the clinic. And that piqued my interest in medicine to some degree. But at the same time, over the holidays, I would accompany my mom to work. So I would um, help her clerks and her secretaries, kind of tidy around and generally feel useful. And I would sit in open court when she was presiding over cases. And I just felt this sense of theater in court. It seemed very interesting, very grown up, very theatrical.
Mm-hmm.
All the legalese they would speak, the demonstrations, the practices, the milords, and all that. So it seemed interesting and it seemed fun and it seemed like something I would want to do. So when I got into secondary school, which is where you would now start deciding after junior secondary school what line, either the arts or the sciences, I decided to play the middle. So I kind of straddled the fence. And so I took courses like biology, physics, chemistry, playing safe. And then I took courses like economics, government, literature, because at that point I hadn't quite decided whether I was going into law or I was going into medicine. But obviously, I was only delaying that decision. So by the time I got to the second year of senior secondary, I had to make a choice, right? So I think I then retreated into myself to reflect and decide. And the interesting thing was, neither parent had made any input into that decision. They were both of the mindset that we should decide what we want to do for ourselves. But you know when, because they know you're choosing between their own lines of profession, you could sense that deep inside, each person probably wanted me to veer into their line of work. But I think choosing medicine was because I'm a very hands on person. I can be very touchy feely. And so I think thinking about the opportunity to use my hands to help and to help patients towards their journey towards healing was a significant part of that decision making. I mean, in law, you're using your words, you're using your writing, both orally and written. So I think that's the difference for me was, whereas in law I would be using intellect, using words, using writing to help correct wrongs, for me to make that choice in medicine, I think it was more about having that one-on-one interaction with patients, having the
Mm-hmm.
opportunity to also use my hands in helping people correct the wrongs that illness has generated in their bodies. And I think that for me was what swayed me into medicine. And then in medical school, by the time I did my first medical post, it just seemed like every time I was on ward rounds with those in cardiology, it seemed mind blowing. And so I had this wonderful idea that I was going to be a world class cardiologist, heart doctor for the world. It was like it just seemed so romantic and so inspirational.
Yeah.
But by the time we got into our final years in clinical work, I saw the differences in equitable access to healthcare. I saw the differences between patients who came in to the hospital from the city where the hospital was located. I went to medical school in the University of Nigeria. You probably know of Nsukka, but we were in Nsukka for only the first year of medicine, and then subsequent years we were in Enugu, which is the capital of Enugu State, where the university is.
Mm-hmm.
And I would see the difference in patients who came from different villages to the hospital and the differences in people who came from the city. So the stark difference and the impact of social determinants of health, the lack of access to things that in most parts of the city were very available, clean water, access to education, food. It just raised to me the fact that there were a lot of inequities in healthcare, that I then thought that for a more impactful career, I should be thinking about venturing into public health, into health policy, and the more administrative and leadership aspects to healthcare. And so by the time we were towards graduation, I remember someone at the gate of of the teaching hospital saying, "Oh, that's so you guys are getting ready to round up. What area of specialty would you be thinking of going into?" And I said, "Public health." And the lady stopped and she stared at me for a couple of minutes and she said, "Public health. Why on earth do you want to waste your brain?"
Yeah.
And I was astounded. I mean, obviously, she's one of those people who, speak their minds, no holding back, no hesitation. I didn't ever fathom being confronted with that question. I didn't fathom anyone thinking that public health was a lesser than specialty than others. And it took me back to my community medicine exam in my fifth year. And apparently, I did quite well in the oral exam. And the examiners asked me, "Wow, that was a fantastic showing. So, would you consider, or will we look forward to welcoming you into the field of public health?" And I said, "Oh, no, I'm not interested in public health." And they said, "Why?" And I said, "It involves too much traveling." And they then spent the next 3 minutes trying to convince me that public health doesn't entail so much traveling, that I can actually organize my career so that I don't get to travel so much. And they were quite intent on convincing me, and I think they succeeded. But then they succeeded because there was already that niggling feeling about the inequities in healthcare and what I could possibly contribute to help address those inequities. And so that's how I veered into public health. So after graduation, I did the housemanship and the youth service. And then I went on for a master's degree in what was then international health management, which today would have been global health. So I did that master's degree in the United Kingdom. And of course, a lot of the class were looking at joining either the NHS or major healthcare consultancy firms.
Mm-hmm.
And so each time they were going for career days or career talks where they were trying to inspire those of us from, this was in Imperial College London. So they were trying to inspire us to join any of their firms. I would tag along, basically for the sandwiches, the orange juice, and maybe a little champagne. So, because I was intent on returning to Nigeria and joining the public workforce, the public sector, to contribute to healthcare delivery.
Awesome, awesome. I mean that's been an interesting journey. Looking at your motivations and how you ended up in public health. I know both of your parents must be, I mean, fulfilled for what you have achieved so far. So, at your current role, can you walk us through, some of the highlights and um, what really motivated you to take such a political role in quotation?
The truth is, I never actually saw myself taking this sort of political role. That's the honest truth. Being at the federal level of policy making for so long, I'd been at the federal level since 2009, and I was thinking more along something else, an expansion of what I'd been doing at the federal level. Because when you're in policy making at that level, you're kind of removed from the nitty gritty of politics. So somewhat technical, more regulatory, more decision making and coordinating than being involved with politics as we know it at the subnational levels. But when the offer came for me to join this River State Executive Council, the River State government, I think the major motivation for taking up that role was it's a state with a very high population. It's a state that has massive inequities because it has a very interesting topography. A major part of the state is upland, and a significant part of the state are in remote and riverine communities. So you can imagine the implications for access to healthcare. And so the state in itself has high maternal mortality rates because of inequalities and inequities regarding access. There's also high child mortality rates, especially newborn and infant mortality rates. And so I would say that it was the opportunity to contribute positively to transformational change at the community level for healthcare access and improvement in healthcare outcomes. I would say that that was the motivation to accept and take up this role to serve.
I think this is a good motivation to kind of push you in the forefront. And most of the time, I say that it's about time that experts like yourself take on the battle in the front lines to try and engage politicians to some extent, whilst also delivering. Thank you so much for walking us through your journey and your motivation to take up this role. But in your experience working in the healthcare system in Nigeria, I know it's almost similar to Ghana. How would you characterize the health system in Nigeria?
Not for the faint of heart. The healthcare system in Nigeria, I mean, if we look at it globally, we say okay, it's organized across three levels, similar to Ghana. We have the primary healthcare sector, we have the secondary level health sector, and then we have the tertiary, the teaching hospitals. But the interesting thing about Nigeria is, and I'm sure you draw lots of similarities with Ghana, is the majority of our population are in rural and in remote communities. So what this means is that the bulk of the healthcare facilities are primary healthcare centers that are supposed to cater to majority of the health needs of the people. But a lot of times there hasn't been significant investment in enhancing or ensuring the optimal functionality of such centers. And so when you go into any of the teaching hospitals, you see people, like I shared from my training experience in medical school, you see people who are coming from very far, very remote communities, for them at significant expense to come into the city or to come into wherever that teaching hospital is located. Usually these teaching hospitals are in the cities, in the urban areas. Whereas if our health sector was optimally functional, those conditions should have been managed ideally in, if not the primary healthcare center, then in the next level, cottage hospital, general hospital, or zonal hospital, that would be the referral facility.
Hmm.
But because of years and years of neglect, those a lot of those facilities are not functional. Those that are so suboptimally functional that they can't deliver the quality of care that is needed. And so for several years now, there's been this increased push and attention to the primary healthcare sector. And if you listen to the current Minister of Health, the coordinating Minister of Health and Social Welfare, Professor Pate, a lot of the reform now at the national level is towards strengthening not just the primary healthcare centers, but also the referral facilities, which is the general hospitals where they would be referred to in the event of any complication or any condition that has gone beyond the capabilities of the primary healthcare sector. So our health sector is quite fragile, quite fragmented. You also have programs that are run for various areas that are only recently trying to be integrated into the systematic healthcare delivery system. So a lot of those programs had been siloed, running independent or parallel to the system, with significant capacity development. People who are employed or engaged within such programs gaining significant skills, well remunerated, but they're outside of the mainline system. And so with this increased push now for integration, just imagine that transfer of knowledge, transfer of skills to within the system, so that they're not just serving single line programs, vertical programs, but they're also contributing towards the delivery of healthcare in general within the system. So for me, the things that need to be addressed within our healthcare system in Nigeria are the inequity issues, the integration issues, building up of healthcare delivery systems at the primary and secondary healthcare levels. Because if we free up the tertiary hospitals from the tasks of delivering everyday care, then they will be free to soar. They will be free to carry out the innovative research and innovative findings that would stand them out amongst tertiary facilities across the world. But for as long as they're bogged down with seeing patients who could have been easily managed in the primary healthcare or secondary healthcare level, if those were fully functional, then it's like someone who you say is this amazing boxer or this amazing wrestler, and then you send him into the ring with his two hands tied behind his back or her back. So they can't actually achieve their full potential because they're weighed down by the load of the suboptimal primary and secondary levels of healthcare.
Yeah, I think that is a unique challenge, especially the fragmentation and lack of, I would say, structure. It happens in Ghana as well. You have people cross over all the way to the tertiary level without any proper referral system, or because downstream it's not working very well. So, I mean, I want us to focus a little bit on your work specifically at in River State in terms of inequity. What are some of, for example, strategies that you've adopted? I know it's not easy coming from Ghana, that you've adopted that kind of helps improve healthcare delivery and maybe access uh, to your people.
So I would say, being a year in this role, it's still a work in progress. One of the major things that the present administration has achieved was the governor's approval of the implementation of the state health insurance, what we call the River State Contributory Health Protection Program. And the law was passed in 2021, but for various reasons, it just hadn't been implemented. And one of the major milestone achievements, I would say, for healthcare was his signing off the takeoff of this state health insurance. And so in April, we began enrollment, and we began enrollment with vulnerable populations. So we started out enrolling um, pregnant women, children under the age of 5, persons with disabilities, the elderly, people known in communities to be living in poverty. We started enrolling those people onto the scheme so that when they go to registered facilities, they would have access to quality healthcare. So that, I would say, is one major thing that has been done to address some of these inequities in access. The other thing is the approval for the employment of 1,000 health workers within the state health system. And these health workers are across various communities in the secondary level hospitals that have been somewhat neglected over the past almost 2 decades. And so if you go into most of the communities, a significant challenge in most of those facilities is the manpower to deliver quality healthcare. And so I believe that with this employment, we'll be engaging people who would be deployed to a lot of these communities and help close the gaps because the need is significant. So, of course, 1,000 isn't correcting the problem completely, but at least it's taking us several steps in the right direction. The other thing is the approval of the State Executive Council, I mean, under the leadership of the governor, to start the upgrade, the renovation of various community hospitals. And for now, we have about five such hospitals, six in fact, that have commenced work. So we have the zonal hospital in Ahoda, we have the zonal hospital in Omoku, in Bori, and in Degema. These are very different, very diverse populations, high population areas, and these zonal hospitals are not meant to serve their own local government areas. They're also meant to serve contiguous local government areas as well. And for many years, there hasn't been work to upgrade them, to rehabilitate them, and ensure their functionality. Also, there's one that I'm particularly excited about, and that is the General Hospital in Bonny. So, if you've heard about Bonny, it's a riverine community, and I went there a couple of weeks ago. Presently, it's only accessible by sea,
Hmm.
and so you can imagine what the challenges are for healthcare in such a community. For over 20 years, the hospital there has not been renovated in any way. And so, even looking at some of the patient beds, you could tell from the rusting, you could tell even from the frame of the equipment, you can have an idea about the time frame for when those equipment were installed, and nothing has changed. And I had the opportunity to speak to women because the day I went happened to be their antenatal care day. So I spoke with pregnant women, sounded them out, heard what their challenges were. And what was especially touching was the fact that they're committed to that health facility. Some of them have had babies there, three or four children there, and it's a major part of their community life. And so to hear their passion for wanting the hospital to function at the very top of its potential is something that I'm excited to be part of the administration's work in renovating and delivering a quality healthcare facility to the people. There's also a plan for a new general hospital in Rumigbo, which is in Obiakpo local government area, which is one of the largest local government areas, highly populous, and interestingly, urban and semi-urban local government area. And there hasn't been a general hospital there, perhaps because it's also urban. So the thinking has been, oh, but there are teaching hospitals, there are tertiary facilities in the local government. But when you have a local government of that size with a massive population, the fact that there is one teaching hospital or two teaching hospitals in a nearby local government that is also urban doesn't quite cut it. And so, one of the things we're very, very thankful for is the fact that the governor has approved that a new general hospital, because there's a significant population that will benefit from having access to secondary level care in that facility. And of course, it will provide referral services for the numerous primary healthcare centers that are located in that local government area. Another thing is the drug rehabilitation center that's also being built as well. Substance abuse is a major problem and is often left out of the discussion,
Yeah.
mental health care. And so the revitalization of the neuropsychiatric hospital and the building of a drug rehabilitation center and major contributions to mental health care delivery that we're excited about here in the state.
Awesome, awesome. It seems like that's a lot going on. Hopefully things don't change. I want us to pivot a bit to maternal and child health. I know you're passionate about maternal health care. In your experience working in Nigeria for a very long time, what do you think are some of the main barriers to improving maternal health in Nigeria, and specifically in River State, where you currently represent?
So in the States, we have a percentage of women who deliver with the presence of a skilled birth attendant is about 65%. So while some would say, well, that's above 50%, it's not so bad, it's not as bad in certain places, I would say there's still so much more to be done because a significant proportion of the maternal deaths and the newborn deaths that occur would happen in that very important, say, 35%. And so if you listen to community members, you listen to women of reproductive age, you'll find that a lot of the hindrances is the availability of skilled personnel at the primary healthcare centers or at the general hospitals where they would seek to deliver. Another thing would be financial access to healthcare because there is that cost component as well. And so
Hmm.
some of the things that we're looking at, so I've mentioned already the state health insurance, the employment of health workers. Those are some of the things that we are using as strategies to help address poor maternal and newborn health indices. The other thing is we to also drive demand, there are policies for free childbirth delivery services for women who have attended a certain number of antenatal care. So that way, we are encouraging women to attend antenatal care, not just for the sake of it, because we also realize that that provides a prime opportunity for the healthcare workers to assess risks in the different pregnant women. And so they already know those pregnancies that are high risk and have plans in place for how to manage the whole delivery process for them. But at the same time, the family benefits from having free delivery services by virtue of the fact that they attended the minimum of antenatal care visits that was required for them to benefit, so that it's a win-win. So these are some of the things that we are using as strategies to address poor maternal and child health. Another thing I want to add is we realize that a lot of the population are in rural and remote communities. So if we want healthcare workers to be available to provide services, there have to be some level of incentives as well for them to keep them located within communities, make their stay within communities as comfortable as possible. So for the healthcare projects which I mentioned, there's for all the zonal hospitals, there'll be comfortable staff quarters available for key staff of the zonal hospitals so that they live on site within the communities and are easily accessible in the event that they're out of our needs for their services in the hospitals.
Awesome, awesome, awesome. And I mean, looking at your work, you seem to also embrace the idea of community engagement. I mean, to what extent do you think community engagement plays a role in delivering healthcare, especially in the settings where we typically find ourselves?
I think community engagement is everything, to be honest with you, because we can design fantastic policies, but if we don't engage communities in both the design, the co-creation of those policies, the planning and the implementation, a lot of those policies will fall flat. And I think that that is a significant part of why in Nigeria we say, oh, we have beautiful policies, but the problem is implementation. A lot of the times we haven't involved the communities. They are the ones with the lived experience, they are the ones with the lived challenges. They know where it pinches, they know why certain things don't work. So when we have ideas and that we're not sharing, we're not discussing them in an atmosphere where they can critique, where they can contribute, then I think we're shooting ourselves in the foot, because most times those beautiful plans and policies just won't work. So community engagement is very, very big on the success I think we can achieve in the health sector. Because I've also said in several spaces that healthcare is not a healthcare issue purely. Healthcare is a societal issue. Healthcare is an issue for families, for people, for families, for communities. And as the Commissioner of Health, I believe that I am answerable to everyone, because everyone has a health concern. Everyone has a stake in health. And so I don't see my work as purely for those in the health sector, but for everyone in the community and everyone in the society. And I think engaging communities is almost like a surefire way of getting progress in our advancement towards universal health coverage and positively transforming our health outcomes.
I mean, back in Ghana, a lot of physicians usually are, you know, adamant on like taking up positions that will bring them closer to political power, because they feel that, the politicians cannot be trusted to some extent. Um, but you in this position, what are some of the unique challenges that you faced in terms of driving your policy, trying to convince the people upstream that what you're doing, it's important? How have you navigated this route so far?
I think the significant challenge would be healthcare has a lot of challenges, but at the same time, we learning for me, navigating this challenge has been learning a bit of patience, compromise as well, understanding that basically you have a pot of resources and those resources are not infinite. Those resources are finite, and they would also, while they some would go to health, some would also need to go into other sectors as well. They will need to go into education, they will need to go into agriculture, water resources, the environment, critical infrastructure. So being being able to look at it holistically and realize that even though I'm seeking to drive advancements in investment in health, they're all the principal decision maker has decisions to make across all the sectors. And so that level of understanding and patience is necessary to navigate the challenge, because we can't do everything. And so learning to prioritize is very important. Identifying what are the low hanging fruits that you can achieve with minimal resources, trying to be innovative as well, and then having a very open and receptive posture that welcomes ideas from across the board. So you're not just taking ideas from senior levels of management, but even officers within the healthcare space who have on the ground experience, who interact and engage with patients and the communities directly. So being open to their suggestions, ideas from wherever they may come, being able to distill them and put heads together as a team to advance our healthcare sector. It's challenging because healthcare is complex. Healthcare has many moving parts, and the the problems are immense. But we have to start where we are, and we have to start where we are together so that we can address the challenges as they come and celebrate our little wins as we go on to celebrate even bigger wins.
Yeah, yeah, I agree. Celebrating little wins, it's crucial. Uh, it's tough, but I mean, if we have people who are determined to face the challenges, I think that is the only way that we can make things happen. Um, we've explored a lot of the issues in terms of the health system in Nigeria and you know in extension Ghana and similar West African countries. I want our audience to get to know you much better. So we are going to go through some fun lifestyle like questions. Um, I mean, if any of these questions, if your answer is going to annoy any group of people, this is only for fun, right? So let's start with
Yes, disclaimer.
let's start with I mean your inspiration and motivation. So who or what inspires you most daily? Or how do you stay motivated? Is there one person, if you can mention one person who has been motivating you, throughout your career?
Uh, I would say my husband is my chief motivation officer. Definitely, he's been a great source of motivation. He's been a driver. My parents as well, my siblings. I have quite a supportive fan club with with my husband as the president and my children. So I would say they keep me significantly motivated. But on a day-to-day basis, in the course of my work, I would say two things keep me motivated. Being in the communities
Mm-hmm.
is one, and then being around children. Anytime I'm around children, I'm like, even if my energy was low, it just gets me up there. And so I would say if I find that over several weeks, I've not either been in the community or had a one-on-one engagement with children,
Mm-hmm.
I find a way. I find a way.
Okay, I mean
It's always
it's
guaranteed to work.
yeah, it's always fun to be around children. Okay, number two, can you share a fun fact about yourself that most people don't know?
Most okay, I was yes, most people don't know, but the people closest to me know. Whiz Kids Ojo Elegba is sure to get me no matter where I am or what I'm doing, it gets me moving. And it's almost ridiculous. So I would say
Okay, okay. I mean, yeah, that's
so
excited.
this one I know would annoy some people who are not on the Whiz Kids spectrum.
Yeah, yeah. Okay, so what is something on your bucket list that you are excited to accomplish in the future?
Um well I'm hoping to soon complete my doctorate with the University of Groningen in the
Mm-hmm.
Netherlands, my PhD in global health. So that is something on my bucket list. But Bali is definitely on my bucket list.
Mm,
Yes.
exciting. Have you been to Ghana before?
Of course, several times.
Okay,
So Ghana is not on my bucket list. I've been to Ghana several times.
okay. You know why I'm asking this question. Next question is, what is your favorite African dish?
No, I know what you're hoping to hear, and it's not jollof rice. My favorite African dishes are one nkwobi, which is a very savory cowtail dish. Very, it's delicious. You should try it sometime. And
Ah,
then
okay.
in Port Harcourt, bole and fish, which is roasted plantain and smoked fish. Awesome. I
Okay.
said in Port Harcourt because bole and fish doesn't taste the same outside of Port Harcourt. There's something about the atmosphere that completely changes the vibe. Then last would be seafood okra soup with
Okay.
eba. So those
Yeah.
are my favorite African dishes.
Yeah. I think like
I
some of
steered clear of jollof rice, please.
the Nigerians will be expecting you to mention at least Nigeria jollof. And you didn't mention it. So that
No,
indirectly says that it's, the Ghana jollof is better, right? Anyway, so
no.
all right. So if you're not working or if you're not busy with work, what are some of your most favorite hobbies that you do?
So if I'm not busy with work, I'll either be before reading, I would be checking out what is the newest Netflix
Mm,
African movie.
okay.
So yes, so I have quite a list of favorites. King of Boys, directed by Kemi Adetiba, amazing, and Afamefuna, which I watched over the Easter. I even did a special dedicated post to Afamefuna.
Oh, I see.
Awesome, awesome movie. And then every now and then, perhaps the occasional Korean drama,
Mm-hmm. Mm-hmm. Yeah.
just so I can exchange notes with my daughter, who's also a fan of Korean drama, K drama. So
Yeah.
yeah.
Yeah. Yeah. I mean,
And
like,
then I love reading as well. So I love reading books. I have a mile long book bucket list, but some standout books for me: Women and Leadership by Ngozi Okonjo-Iweala
mm-hmm.
and How to Be a Dangerous Woman by Pat Mitchell.
Awesome.
Those two books are amazing, amazing books that every female leader I think should read.
Should read. Okay, that's fair. Okay. Last question on this stream. What is your typical morning routine like?
Depends on how I went to bed. And so if I went to bed quite late, it will be jumping up, generally trying to get myself in order quickly.
Mm-hmm.
So, but routinely, my morning routine would be waking up and starting my day off with prayer and meditation,
Mm-hmm.
trying to settle myself and plan my day. So this would take about 30 to 45 minutes before I start with getting ready to set out and conquer the world.
Okay. We are almost at the end of our podcast. I think it's been very exciting, both educative and also entertaining. But if you are to uh, if you look back and you are to list at least one of the achievements that you're most proud of, what would that be?
I would say an achievement that I would be most proud of, and I would say I share this achievement with my husband, would be every time we see how both our children have grown into self-assured, driven, purposeful, empathetic, and compassionate humans. We're just blown away by the privilege of being being chosen to be their
Mm-hmm.
parents. I think that would be for me the most significant achievement.
Yeah. I know it's not easy. Uh, for uh, for the young parents, it's one of the toughest jobs that you ever do, and being able to do it well, it's indeed an achievement. But before you go, I know now, like, there are lots of people, including, from physicians to nurses to journalists, who are really coming into the public health space. Uh, what advice would you give young professionals and maybe students who aspire to make a real difference in healthcare and public policy?
I would say to them that no opportunity you have is wasted, no role that you have is useless. Wherever you find yourself, make the most of where you are. Try and conceptualize a purpose for that role that is bigger than just you holding a role. What is the significance? Think deeply about how your being in that role can help serve others. If you're able to articulate that, believe me, that would be the starting point for many, many great opportunities and roles. The thing is, we live in a social media space now, and
Yeah,
people see people doing amazing things, holding major roles, and thinking that that's where they started. No one ever started at the top. They started somewhere
somewhere.
that you would
Hmm.
think, yes. But even no matter how lowly a role is, it has great significance. So imagine a cleaner in a health facility that's committed and dedicated to their role. If they can think that for every patient who comes into that hospital or health facility, they wouldn't leave with an infection simply because they were on duty. Imagine the implications for infection prevention and control, antimicrobial resistance for that health facility. So when the hospital or the health facility is winning awards for the least number of infected patients, part part of that winning team is the cleaner. So if we can get ourselves to a place where we appreciate where we are currently and apply ourselves fully to that role, then everything else will just be a walk in the park, I can assure you. Because when you apply yourself in the so called little things, when the medium and the big things come, you'll be ready. You have a culture and a habit of applying yourself, and you will always stand out. So, that would be my advice to anyone, any up and coming leader.
Awesome, awesome. Thank you so much. Thank you so much for your motivating words. It's been an exciting episode chatting with you and getting to learn and know the Nigeria health system more. And I think it's something that a lot of people will love to hear and learn more about. So thank you so much. I'm excited to see how your role unfolds and how the future holds. But please keep updating us as you've always been doing on LinkedIn and Twitter, so that we all in the background will be supporting you. Thank you so much for joining us on this episode.
Thank you for inviting me, and thank you for always being so supportive. Thank you.
All right, thanks. Bye.
Bye.